Good morning, everyone. We are live on 154th International Weekly Session. So today we have a topic, euthanasia. We are on 23rd of September, 9:30 a.m. People who want to join this meeting can join on 818-859-11572. I welcome all the members from CMAAO and our esteemed speaker. To introduce her, she's Dr. R. Sudha, MD Forensic Medicine with 30 years of teaching experience in undergraduate and postgraduate medical student. She has published many research papers in various states and nationals and journals. She's a member of Advisory Committee of Women's Safety Wing of Government of Telangana and micro-legal expert. She's an expert speaker on PASCO and sexual assault cases and guest faculty in National Police Academy. She's also a guest faculty in Judiciary Academy of Hyderabad, conducting regular training sessions for medical officers, police officers, and judiciary. Over to you, ma'am, for this topic, and I would like to share this presentation. Ma'am, you can start the presentation. You are muted right now. You need to unmute yourself. Ma'am, you need to unmute yourself.
Yeah.
Okay.
Am I audible?
Yes, thank you.
Oh. Thank you so much for introducing me. And thank you. And I welcome all the dignitaries who are participating. I welcome all the participants. Now, my topic for today is euthanasia. That is mercy killing, guidelines for the end of life care and decision making. We cannot change the outcome, but we can affect the journey by Anne Richardson. Dignity of human nature requires that we must face the storm of life. So all the material I have collected from various sources. I am not the sole expert on this topic. Naturally I invite additions and questions. You know this couple from Chandigarh, retired professor couple who executed the living will. They said they want to die with dignity. This is the first case of living will. Professor D.N. Johar, 71 years, and his wife, 63 years, were the first professor in the country to execute the advanced directive after Supreme Court judgment of 2018. That is about the guidelines of the Supreme Court. A legal expert, Professor D.N. Johar, is the former Vice Chancellor of Dr. B.R. Ambedkar University of Agra and former Chairman of Law Department of Punjab University. His wife retired as head of the Department of Botany in Postgraduate Government College Sector 2 of Chandigarh. They took 9 months to prepare the living will with 2 pages, sharing 3 reasons for filing the will. Right to live with dignity include right to die with dignity under Article 21. Number 2, he wants his body organs to be donated to the others. Number 3, he also wants to donate his body for the research purpose, that is for the medical schools. So now I want to discuss under the following heads: legal issues of the end of life care in India, stand of India government, the stand of Commission of United Nations Human Rights Committee, important Supreme Court judgments, advanced directive and living will, and finally conclusion. To start with the introduction, prolonging the life with sophisticated and modern methodology in patients suffering from terminal illness and vegetative state. Is it justifiable or not? Because as per the Hippocratic oath, we cannot, the primary duty of a doctor is to save the life of the patient. But can we end the life of a patient when who is in terminally ill. Now the question of euthanasia and the advance directive comes. In India, there is no legislation about euthanasia, but Supreme Court issued guidelines in 2018, which are valid till new legislation is brought out. The end of the life care is healthcare for a person with terminally advanced, progressive, or incurable illness, which includes physical, emotional, social, spiritual support for the patient and their families. Finally, the goal is to control the pain of the individual. End of life care includes palliative care, supportive care, and the hospice care, the treatment in the hospital. It requires decisions about the palliative care, patient rights for the treatment, medical experimentation, ethics and efficacy of the hazardous medical treatment, and ethics and efficacy of continued medical intervention. Because end of life care patients require a lot of medication, a lot of treatment procedures, etc. And allocation of resources to the hospital. And finally, most important, the patient autonomy. Coming to the definition, the WHO definition. WHO defines palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illnesses, though the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychological, and also spiritual. The 4 values of the medical ethics are, at the end of the life care varies from country to country because different countries have different laws and different guidelines. The 4 values of the medical ethics involved are autonomy. Patient has the right to choose or refuse the treatment. He can select the doctor, he can select the method of treatment, etc. Beneficence. A doctor should act in the best interest of the patient. Non-malfeasance. First, do not harm the patient. Whatever the treatment is given, we should not harm the patient. Justice. It concerns the distribution of health resources equally. So the medical facilities should be equally provided to the poor, irrespective of the caste, religion, and the financial status. The other 2 more values are dignity. It is the dignity of the patient as well as the dignity of the doctor. The second value is truthfulness and honesty. Informed and truthfulness. The doctor should not hide any secrets. He should tell the patient truth only. So, honesty should be maintained. The Indian Society of Critical Care Medicine developed directives. The physician's attitude towards the patients in ICU, how the physician has to treat. So, the physicians are trained how to treat a patient in the ICU. Physician's objective and subjective assessment, honesty and accuracy, disclosure of the prognosis. You have to tell the patient always the truth about the prognosis of the disease, whether it is good or bad. Early option of the palliative care in the prognosis. Ensuring consistency among the team, because the palliative care is a teamwork. So you have to ensure the consistency of the teamwork. Gives checklist when to put the patient on the end of life care. So depending on the rules and the guidelines given by the Supreme Court, the physician treating doctor will decide when to put the patient on the end of life care. What are the challenges faced in giving the end of life care? Dying patients are especially vulnerable, and adequate informed consent may be difficult to obtain. Sometimes the patient may not be able to give the informed consent in a correct manner. Balancing research and clinical roles it is particularly difficult. Risk and benefits of the palliative care research and difficult to assess, because sometimes because of the seriousness of the conditions, it is difficult to assess the risk and benefits. There is no policy in India at the national level on the palliative care or on the end of life care. Euthanasia is an intentional premature termination of another person's life, either by direct intervention, active euthanasia, or by withholding the life prolonging measures and resources, which is known as passive euthanasia. The Oxford Dictionary says painless killing of a patient suffering from an incurable and painless disease or in an irreversible coma, when the patient is in irreversible coma. Coming to the types of euthanasia, voluntary euthanasia at the expense or implied request of that person, non-voluntary for the persons who is in coma, unable to give consent, active euthanasia or positive euthanasia or aggressive euthanasia. It is an illegal act of commission by use of lethal substances. Passive euthanasia or negative euthanasia or non-aggressive euthanasia. That is legal withdrawal of life supports like ventilator, heart and lung machines, etc. Active euthanasia is permissible in Belgium, Canada, Netherlands, Colombia, Luxembourg, and Western Australia. Physician-assisted suicide is permissible in Switzerland, Germany, Australian states of Victoria and the state of Colorado, Vermont, Montana, Maine, California, Oregon, New Jersey, District of Columbia, Hawaii, and Washington, D.C. in the US. Active euthanasia is physician or third party administered the lethal medicine. In case of physician assisted suicide, patient takes the medication on the advice of the doctor. Advanced Medical Directive. What is Advanced Medical Directive? The Black Law Dictionary defines Advanced Medical Directive as a legal document about one's wishes about medical treatment if one becomes incompetent or unable to communicate. So this is called as Advanced Directive. The three categories of Advanced Directive are living will, power of attorney, and medical care proxy. First, living will. A living will is a written order which a person passes when he is alive to refuse medical treatment when he goes into coma or persistent vegetative state. It can be do not resuscitate, do not intubate, allow natural death. These are the three components of the living will. California was the first state to legally sanction the living will. Do not resuscitate means no CRP, no cardiac drugs, no placing of the breathing tubes, etc. It is practiced in most of the world without much legal issues. Do not intubate means no breathing tube. Allow natural death means discontinuing resuscitation, artificial feedings, fluids, and other treatments, etc. Next, coming to the power of attorney. It is the document to appoint a trusted person to take healthcare decision when the patient is not able to take such decision. When the patient is not in a condition to take any decisions, then another person can be appointed. He can make bank transactions, sign the checks to pay the utility bills when the patient is incapacitated. Next, healthcare proxy. It is a legal document in which the individual designates another person to make healthcare decision when the patient is not able to make decisions. That is healthcare proxy. Next, coming to the persistent vegetative state, post-coma unresponsiveness. The disorder of consciousness where the patient with severe brain damage in a state of partial arousal rather than true awareness. They have a normal heart rate, breathing, and the donor requires advanced life supports without purposeful, coordinated, voluntary responses. After 4 weeks in a vegetative state, the patient is classified as persistent vegetative state. So to say that the patient is in should be in 4 weeks. Next, coming to the policies of euthanasia. International position on euthanasia differs from country to country, as I said. The European country of human rights and UN Human Rights Committee, they have different rules and regulations. The stand taken by the Law Commission of India is, in 2006, a draft bill, the medical treatment of terminally ill patient bill is prepared. And it is made when euthanasia and assisted suicide is lawful. 100 years ago, when medical technology has not invented artificial methods of keeping a terminally ill person alive by medical treatment, including by means of ventilator and artificial feeding, such patients died naturally. So 100 years before, patients used to die naturally because there were no ventilators at that time. But the modern medical technology enables the patient to prolong the life to no purpose, and the patient could go through extreme pain and sufferings. Those patients can have right to refuse the modern medical procedures. So in 2011, the Law Commission was asked to give opinion on the law on euthanasia. In August 2012, the Law Commission came out with a detailed 241 report titled Passive Euthanasia, a Relook. In this report, the concept of right to self-determination is mentioned. According to the changes were made in the earlier draft bill titled The Medical Termination of Terminally Ill Persons, Protection of Patients and the Medical Practitioners Bill. So the previous bill was changed to Passive Euthanasia, a Rule. The Law Commission of India clarified that where a competent patient taken as informed decision to allow nature to have its own course, the patient is, under common law, neither guilt of attempt to commit suicide, nor is the doctor who omits to give treatment guilt of abetting the suicide or culpable homicide. So neither the doctor nor the patient are liable for punishments in after the euthanasia policies. The stand taken by the Indian government of India was not in favor of any law on euthanasia because Hippocratic oath is against the euthanasia. Hippocratic oath says that the killing of a person is unlawful, and the most important duty of a doctor is to save the life of the patient. Next, progression of medical science to relieve pain, etc. in a terminally ill person will suffer a setback. Now, with the advancement of the medical technology, the terminally ill patients are getting relief from pain with different methodology and treatments. An individual wish to die may change his opinion in the final stages. That is another problem. Suffering is, this is the stand taken by the Indian government. Suffering is the state of mind and perception depending on various environmental and social factors. Advanced medical technology made possible for good pain management in cancer patients, etc., where euthanasia may not be required. Wish of euthanasia in mentally ill patients can be treated with psychiatric care. So, wish of euthanasia means mentally ill patients may be having some suicidal tendencies that can be treated with the psychiatric care. Difficulty in quantifying the sufferings. And can the doctor say that the disease is incurable and the patient is permanently invalid? So it is a big questionnaire for the doctor to decide whether the disease is incurable and the patient is permanently invalid. Defining bedridden patients is not medically possible sometimes. Lot of psychological pressures and trauma to the doctor who is required to conduct euthanasia. So conducting euthanasia is not an easy task for the doctor. It requires a lot of rules and guidelines to be followed by the doctor. So it is a big challenge for the treating doctor. Stand taken by the Indian government are After various meetings held by the expert and expert committees, a formulation of legislation on passive euthanasia is made. It is uploaded a draft bill on government website titled Permanently Ill Patients, Protection of Patient and Medical Practitioner Bill 2016 on 6th May of 2016, along with the explanatory brief mentioned in the Law Commission 241 report. The matter remained under consideration and the Supreme Court Constitution Bench, meanwhile, gave its judgments on the issue in 2018 by framing guidelines for advanced directive, which is legalized in passive euthanasia as an interim measure till the matter gets legislated. So in 2018, Supreme Court issued the guidelines about the euthanasia, which are followed till further legislations are made. The United Nations International Convent on Civil and Political Rights, which ensured the protection of civil and protection rights in General Assembly in December 1966, came into force on March 23, 1976. Right to Life Article 6.1 of ICCPR states that every human being has inherent right to life. The right shall be protected by law number 1. One shall be arbitrarily deprived of his life. The United Nations Human Rights Committee, the law allowing euthanasia must provide effective procedural safeguards against abuse to be compatible with the state obligation to protect the right to life. The right to life with dignity to include smoothing of the process of dying when a person is in a vegetative state or living exclusively on the artificial aids. So the Indian legal perspective, I want to say a few cases about P. Ratinam versus Union of India case. Two individuals, P. Ratinam and Nagabhushan Patnaik, filed a writ petition in 1994 under the Article 32 of Constitution, attacking the constitutional validity of the Section 309 IPC, contending that it is violation of the Article 14 and 21. So they filed a case attacking 309 section of the IPC. The judgment held that Section 309 IPC deserves to be effaced from the statute book to humanize our penal laws. In Jian Kaur versus State of Punjab case, the appellants were convicted by the court under Section 306 IPC, that is abatement of suicide. Conviction was attacked on the ground that Section 306 IPC is unconstitutional violation of Article 21. Questioned the constitutionality of the 306. So, depending on the previous judgments, Jian Kaur filed this case. Two judges bench in P. Ratinam case said that if a person has a right to live, he has also right not to live. The court in Jian Kaur case said that the right to live is the natural right embodied in the Article 21, but suicide is an unnatural termination of the life and declared Section 309 IPC as constitutional. Thus, the court in Jian Kaur case, apart from overruling the P. Ratinam, upheld the constitutional validity of the 306. Another case is Aruna Ramachandra Shaban case versus Union of India. But the issue of euthanasia was raised again before in the Supreme Court in 2011. The details of this case are on 27th November 1972, Aruna Shaban, 25 years old. She was a nursing staff, sexually assaulted and strangled with a dog chain by Valmiki, a ward boy, and remains in the vegetative state for 41 years. On 24th January 2011, the Supreme Court responded for the plea for euthanasia filed by the journalist Pinky Virani, setting up a medical panel to examine her. But the court rejected the petition on 7th March 2011. But make a made a landmark opinion allowing the passive euthanasia in India, making the guideline. Aruna Shabun died on 18 May 2015 with pneumonia in a persistent vegetative state. Another case, Airedale case. The court addressed the legal issues referring the decision of the Airedale case. Anthony Blade was injured in soccer crisis where when he was 17 years old, he was in persistent state over since then. The Guardian appealed for passive euthanasia, but the House of Lords dismissed the appeal. The learned judge opined that withdrawal of life support of terminally ill person, there is always a risk of misuse by some unscrupulous persons who wish to inherit or grab the property. Because the guardians who are interested in euthanasia and filing a case, they may be interested in the property and want for euthanasia. So the court refused. In the interest of protection of patient, doctor, relatives, and the family, as well as the public approval of High Court should be taken for passive euthanasia. Ultimately, the court has to decide in the best interest of the patient, giving due weight to the medical opinion of the family members applying the law of parental patry, where that is, a state or court has a paternal and protective role over its citizens or other subject to its jurisdiction. Means the court is the deciding authority, not the guardian or any other relative who approach the court. Application is filed in the High Court. It constitutes a bench of at least 2 judges, seek the opinion of committee of 3 reputed doctors nominated by the bench. One should be a neurologist, 1 psychiatrist, and 1 physician. The committee of 3 doctors examine the patient carefully and submit the report to the High Court. Then the High Court will also issue the notice to the state and family. After hearing them, the court bench should give its verdict. The court should give decision speedily and earlier. The above procedure should be followed all over the India till Parliament makes a legislation on euthanasia. This is as per the guidelines of the Supreme Court. Common causes. A registered society versus Union of India. Writ petition was filed by a registered society in Supreme Court in 2005 under Article 32, seeking to declare right to die with dignity as a fundamental right, Article 21. The bench referred all judgments in Aruna Shaban case, Arundel case, and the Jian Kaur case. It has been declared that right to die at the end of the life with dignity is not to be confused with or equated with right to die an unnatural death. Finally, the court gave direction and guidelines about passive euthanasia and advanced directive in the judgments in 2018. And this is the flow chart of life and life issues, how the Supreme Court has given its judgment. Supreme Court of India in 94, T. Ratnam case, 96, Jian Kaur case, 2006, the 19th report of the Law Commission, followed by 2011, the Aruna Shaban case, and 2012, Law Commission report, 241 Law Commission report, 2016, Supreme Court of India, where a affidavit was filed, and finally, 2018, Supreme Court guidelines were issued. The directions of Supreme Court for execution on implementation of the advanced directive are, first of all, who can execute the advanced directive and how? The advanced directive executed only by adult of sound and healthy state of mind who can communicate, relate, and comprehend the purpose and consequences of executing the document. Voluntarily executed without any coercion or inducement or compulsion. There should not be any compulsion. It should be with informed consent without any undue influence or constraint. It should be written earlier when medical treatment was made, maybe withdrawn. what should be the contents of the advance directive? Number one, it should clearly indicate decision related to circumstances in which the treatment is withdrawn. Next, absolutely clear instructions in specific terms should be mentioned. Executor may revoke it at any time. So the executor, if he feels well or recovered from the disease, he may take back the will. Executor understood the consequences of executing such document. Specify the name of guardian or close relative who, in the event of executor, becomes incapable of making decision, to authorize or give consent. He has to write some guardian's name or close relatives and mention. In case if there are more than one valid advanced directive, the most recently signed advanced directive is considered. Next, how should it be recorded and preserved? The document signed by the executor in the presence of two independent witnesses and countersigned by local judicial magistrate of first class designated by the concerned district judge. The witness and the magistrate record that the document executed voluntarily without any coercion and compulsion with relevant information. The magistrate shall preserve one copy in his office and keep in the digital format also. How should it be recorded and preserved? The magistrate forwarded one copy to the jurisdictional district court for registration. The copy should be registered. The magistrate informs the immediate family members about the document. A copy is handed over to competent officer of local government, municipality or panchayat. The magistrate shall hand over the copy to the family physician, if any. And when and by whom can it be given effect to? In case of executor becomes terminally ill, the treating physician ascertain the genuineness from the magistrate before acting upon. It should be given effect only after being fully satisfied that the executor is terminally ill and incurable. The physician informs the same to the guardian for the withdrawal or refusal of the treatment. The board constituted by the collector in case of executor is incapable of making decision, the board will take the consent of the guardian. The chairman of the medical board conveys the decision to the magistrate before giving the effect. The magistrate will visit the patient before implementing the decision of the court. The executor can revoke the document at any stage before implementation. What if the permission is refused by the medical board? Suppose the medical board refuses to give permission for withdrawal of the life supports. What is the next step? If permission to withdrawal treatment is refused by the hospital medical board, the executor can approach High Court by a writ petition under Article 226 of the Constitution. High Court constitutes an independent committee with 3 doctors from the general medicine, cardiology, neurology, nephrology, psychiatry, and oncology with 20 years of experience. The committee will submit the report about the feasibility of the acting upon. High Court shall render its decision at earlier, keeping in mind the principles of best interest of the patient. Revocation or inapplicability of the advanced directive. At any time, the executor may withdraw the advanced directive and it should be in writing. Advanced directive shall not be applicable to the circumstances which the person did not anticipate. Suppose some other complications comes or some other serious illness comes to the patient, then the advanced directive is not applicable. If the advanced directive is not clear and ambiguous, it is not applicable. If the hospital medical board decides not to follow advanced directive, then the executor shall make an application to the medical board constituted by the collector. Suppose there is no advanced directive, then what is the procedure? If there is no advanced directive, the person cannot be considered. The next procedure is, if a person is terminally ill with incurable disease, The physician constitutes a hospital medical board and discussing with the family physician and the family members in writing. If the consent of the family members, a preliminary opinion is prepared. If the medical board decides to withdraw the medical treatment, it informs the collector and who in turn constitute a medical board with district medical officer. They visit the patient and take decision regarding withdrawal of the support treatment, which is intimated to the nearest judicial magistrate and the family members. The judicial magistrate visit the patient, verify the record before endorsing the decision of the medical board. If the medical board denies permission, the nominee of the patient can approach the High Court seeking permission under Article 226, as I told you before. The High Court again constitute an independent committee of doctors taking decision at an early possible with the best interest of the patient. It shall be kept in the digital format by the registry of the High Court, which shall be destroyed after expiry of 3 years after the death of the patient. So all the records should be kept till 3 years after the death of the patient. The advance directive shall remain in force till the Parliament makes a legislation. A survey was conducted on the living will. Living will survey was conducted by the healthcare service providers, healthcare at home in 7 cities: Delhi, Mumbai, Kolkata, Hyderabad, Bangalore, Chandigarh, and Jaipur, with a sample of 350 to 400 per from region. That is total 2,400 to increase the publicity and awareness of the living will, because most of us don't know what is the living will. A year after the Supreme Court judgment in 2018, a living will survey was conducted by healthcare service providers, healthcare at home. Survey was guided by the End of Life Care in India Task Force, whose members include the Indian Association of Palliative Care, Indian Society of Critical Care Medicine, and Indian Academy of Neurology. Objectives of the survey was to make the awareness of the concept of living will. So the results of this survey was 85% of them do not want to cause mental and financial trouble to their family in their last days. 74% have not thought of dying, not financially secured their family. 26% has secured their family financially. Of the 4 age cohorts, 25 to 50 years group, 97% wanted choice of treatment line and 36% were aware of living will. In the age group of 36 to 50%, there were no findings. In the age group of 51 to 60 years, only 21% were aware of the living will. In 60 plus, 94% of the people wish to cause least trouble to their family members, obviously. Among respondents who were aware of the living will had living will in 17% in 60 plus age group, less than 1% in 36 to 50 years group, 0 in 25 to 35. Finally, 76% found the concept highly relevant, 15% they require more information, 9% found the living will irrelevant and immoral. So, to conclude about the euthanasia, in the beginning itself, I told you the Hippocratic oath puts a moral and professional duty upon the doctor to save the life of the patient. So, as per the Hippocratic oath, euthanasia is illegal. It is not against the medical ethics to let the patient die. So, if we allow the patient, if the doctor's interest is to save the life of the patient, is it not against the medical ethics to allow the patient to die? Further advancement in medical sciences has complicated the issue, like continued research is being done to increase with the modern medical technology, and not only for curing the disease, but prolonging the human life. With the passage of time, Supreme Court has expanded the spectrum of Article 21 to include the right to live with dignity as component of right to life and dignity. The right to live with dignity also includes smoothing of the process of dying in terminally ill patients and also with persistent vegetative state. The advanced directive has gained lawful recognition in several areas by way of legislation in certain countries. In terminally ill persons or people with PVS with no hope of recovery, priority should be given to the advanced directive and right of self-determination. This is about the euthanasia and the euthanasia law in India and different countries. Thank you so much for patient listening. Any questions, additions?
For a very detailed um, highlighting the issue, I think it's one of the very important topics in not only in India, but various parts of the world. So I would like to invite all the members to share what's going on in their country, to speak about this topic. If you have questions, I think it is not only in the interest of medical profession, but also in the interest of patient's life. I think we've seen a lot of times patients calling in, we don't want to die in a hospital. We want to live a healthy life. We want to, enjoy the life till last moment. So I would request all the members to unmute themselves and please come up with the questions if you have, or please come up with thing. We have Dr. Chong here, and he's a chair for CMAAO. Dr. Monica, would you like to add something before we can move forward? She's from United States.
Thank you,
Yes.
Dr. Sudha. Your presentation was fantastic.
Thank
It
you.
was very comprehensive, and it's covering a very large topic that is
Yeah.
different in different jurisdictions. It's got an intersection of health, of ethics, of legalities, judicial systems. And it really is a conversation about how society looks at death and dying. And
Yes.
the bottom line is death with dignity. And I think this is a very important topic to bring up because it reminds us that this is something that we need to familiarize ourselves, whether we deal with this in our own family or with the patients that we treat. So thank you for a great presentation.
Thank you. Thank you, ma'am.
Questions? Dr. Angelika, would you like to speak something?
Yeah, thank you so much. It was really very informative, and it is a very difficult topic. And this
Yes.
topic should actually start the day when you start making the diagnosis of a incurable cancer. You know there's no treatment for that cancer. You actually then need to start to get a team together to sit with the family, to right in the beginning look at living will. What
Yes.
will the patient wants when the day finally comes? Actually, this day is going to come for all of us. Some just immediately, and others of us will go through a process. And this is
Yes.
something that you need to speak about it, because what we see in South Africa a lot of times is that the wife understands, and she doesn't want the husband on any life supporting equipment. The children are against it, or vice versa. And then you sit in the middle and you watch
Yeah.
this fight going
Yeah.
and play off. And we need to talk about this. Thank you so much. Very, very informative.
Thank you. Thank you so much.
Dr. Wazik, any comments?
Thank you. Thank you very much, madam.
Yes.
I am Professor Mulazim Hussain Bukhari from Pakistan.
Yeah.
And really, it is not only important topic, but it is difficult topic because in the Islam, we really against putting the patient on the death or allowing the patient for euthanasia. I put the two examples during the pandemic in at Lahore. There were two doctors,
Yes.
and both were professors.
Mm,
Because
yes.
in our concept, the life is a gift of God, and it is owned to the God. Wherever the God will give you the life, you have to continue it.
Yeah.
Against
Yeah.
it, yes, against it is very difficult to make the
Decision also.
conditions and the guidance.
Yes.
That is called the will. because when there, you also mentioned in your lecture that there is some interest of the property or something else.
Yeah,
Then
yeah,
again, it is very difficult to make the decision and the will.
yes.
And I put the two examples. There were two professors in 2021, and both were critically ill, and the doctors said that there is no chance of their survival.
Yes.
And they, at that time, there were very few ventilators, and pandemic patients were coming.
Yes,
Among
yes.
them, that almost the same situations of the two patients were there, and among them, one of the patients' owner, wife asked
Yes.
that you allow the ventilator to put up. While on the other hand, there were three daughters of the other doctor professor, and
Okay.
they wanted that their ventilator should be continued. After 30 days, I gave you an example. He is still alive.
Yeah.
After 30 days, the patient survived. Even the condition was similar after their X-ray. So it is in our Islam, we do not, and it is
Yes.
very difficult to decide the terminal patient,
Yeah,
terminal
we
ill
cannot
patient.
decide because the
We
doctor may
cannot
be cured
decide that.
later.
You can that in India and Pakistan we also believe on the miracle, and it is usually
Definitely.
comes from the Allah and the God.
Obviously.
And
Yes.
thank you very much for this topic. And my professor of forensic medicine is there also, Professor Abid Karim. And
Yeah.
if he wanted to add something, because it is no doubt very topic important.
Yes.
I personally attended a conference in the India in New Millennium in New Delhi, and
Okay.
it was on the same topic. And even so, these are very difficult topic. And we should we as a doctor, it is not our authority, because the
Yes.
autonomy of patient you mentioned is very important, and justice is
Yes.
very
Yes.
important to make
Yes.
for the ethical issue. Thank you so much, Sorab,
Thank
and
you.
thank you very much, madam. If Dr. Abid wanted to do, because he is the head of the department and forensic medicine, professor of forensic medicine. Thank you so much.
Thank you, sir. Thank you.
Hello, good morning. Definitely, it's a very difficult topic, and it's a very difficult decision to make to decide whether the patient should be allowed to continue the life and wait for the nature to help him or not. As Professor Mulazim said, in our Islam also it becomes very difficult. I had in my life the same situation last year, when my elder sister, who is also a gynecologist, suffering from the COVID and very ill, her daughter and son, they refused to put her on assisted ventilation, and saying that they don't want to give misery to their mother. So we had no choice except to accept their children will, and she died without any assisted help. But I am still, in a misery that we should have helped her and seen if we could help her with the ventilation. All the facilities are available for her. So again, this euthanasia remains a very difficult topic, and all the laws may be on one side, but the will of the family remains on the other side to decide what to do. And definitely the role of state and the role of medical community should also be considered in that. And it may overrule the decision of the family in this regard.
Yes,
Thank
sir.
you.
Thank you.
Sam?
Hi, good morning. Thank you, Prof. Excellent presentation. It's a concern. One of my patients is a chronic disease. He's been suffering. Then he told me, Doctor, can you advise me how I must continue my life? But if I exceed above 90 years, tell me, I want to die. I don't want to live beyond 90. And I must advise. It's now my conscience, my moral, my ethics. How do you, in your experience, how do you handle that type of situation? Thank you, Prof.
We should follow the state law. We should always follow the state law. What is prevailing with the state, we have to follow the rules and regulations. Otherwise, we will be in trouble. The doctor who conducts euthanasia under great pressure. So we have to observe the rules and guidelines given by the courts and the case guidelines. Then we have to follow the state law.
Yeah.
Thank you.
May I say, Sora?
Yes, go ahead, Dr. Nagin.
Thank you very much. Thank you very much, Professor Subha, for very interesting indeed. It is difficult, everyone knows, because everybody wants to live. To my understanding, that it all is about the psychogenic and what the decisions that people, they want to come and say end of life, that is about the socio-economic. As far as the part of the world where we people are living, like India, Pakistan, Bangladesh, and so on, and all the countries, even in the United States. This is the phase when very poor person, and your study also showed that above the 60, when the people, they don't want to put some pressure on their family, and they decide to end of life. I would like to share just as CMAAO, hence we are having CMAAO and Dr. Chong, I'm sure that he may recall when it was in Japan, we had a very long discussion on euthanasia. And at the end of the decision, when the World Medical Association, they wanted to have some, concern about euthanasia from the CMAAO, it was been left over, and we agreed to the code, but as a doctor, that we should try our level best to save the life, not to advise to die, but to save the life. That was the conclusion where we had been there, and it all was from the Asia. So thank you very much, Professor Sudha. Nice to see your family behind your, where you were asking to stop, but it is so clear. Thank you very much indeed. Thank you. Greetings from Lahore, Pakistan. Thank you.
Thank you. Thank you, sir.
Thank you, Prof. Ashraf. Thank you, Dr. Sudha, for the beautiful presentation. Just to follow up on Prof. Ashraf, yes, I recall that what I said was, in Asia, because fortunately, the dying patient has a lot of support from his family, his clan, his extended family, his clan, and so on. So there's a huge support from his family. So we're less likely to find that the need for euthanasia, in Asian societies generally as a whole. That was something I observed, and I don't know whether you think that's true.
Yes, sir. This is true, but some illegal things are also going on, because in rural areas, some people, old people, they don't feed them, they don't give them proper treatment. In that way, we are indirectly encouraging passive euthanasia. To cut short that, there should be a law. That is my opinion. That's all.
Yes, I see the wisdom of where you're coming from. Thank you. Any other questions from the floor?
Dr. Chong, just
Yes,
for Pakistan has now established legislation which is against and says which is not a successful suicide, the person is being punished. For the punishment, here we have the legislation in Pakistan. So it is very, interesting and funny at the same time too, at least to me as a humanist. The psychology of Pakistan, but we are prevailing over here, that if a person doesn't have successful suicide, he has to face the law. So that is what in Pakistan we are facing at the moment. Thank you.
Oh dear. Yeah, sad to hear that. I think in Singapore we have AMD, Advanced Medical Directive. So there's a register maintained by the Ministry of Health, and you can go to your GP and sign a form and sign up for the AMD, and they will retrieve the AMD when you're in hospital in ICU and decide what to do. So that's the situation in Singapore. We don't have euthanasia in Singapore, but I don't think there are any plans to look at it at the moment. But I wish my New Zealand and Australian colleagues are here, because I remember the Parliament passed some law last year or the year before about something about euthanasia.
If you can cover about the newborn suffering babies on this topic.
Yes.
Newborn suffering. For newborn babies, the guardian who will decide, parents or the guardians have to decide. Because there is another law which is abortion law. So they can go for abortion if the baby is with multiple fetal anomalies and all. It is not actually related to euthanasia. So there is a separate law for the newborn.
Okay.
So-
If there are no other questions from the floor, I'd like to call a close to the meeting and thank Dr. Sudha for her wonderful presentation. And this is always a timely discussion on this topic. It never goes away because there's always a huge need by society to address this particular issue. I mean, it's not an easy issue, and therefore it's many times controversial, difficult, full of landmines, full of pitfalls. But I thank Dr. Sudha for her wonderful analysis and presentation. Thank you very much.
Thank you so much. Thank you for giving me the opportunity. Thank you.
Dr. Sudha for enlightening us for this topic, and we would like to wind up this meeting for now. Thank you, members and all the audience for joining in. See you again.
Thank you so much.